Hello, everyone, and welcome to this week's episode of Ask Dr. Murphy. I hope you're doing very well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce, all the way from Tanzania, Dr. Robert Murphy. How are you doing this evening?
Very good. Thank you very much.
Dr. Robert Murphy is the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, or public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines in U.S. COVID statistics through today, January 31st. We invite you to submit your questions below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with the updated COVID statistics for the United States. Average new hospitalizations per day, 3,801. In the same week in 2023, there were 4,528. Average COVID deaths per day, 133. In 2023, 463. New vaccine uptake for adults, 21.8%, 65 plus, 41.8%, and 11.1% among children. Dr. Murphy, your reaction to those numbers?
Well, the overall numbers are slightly improving, but they're still at a very high level. So we go up in December and January and February, and then start going down in March. So we're kind of just over that peak. Keep in mind, in January, we still had twice as much disease as we had in December. And remember the high-risk groups, 65 and older and under 2 years of age. For flu, it's a little different. There's a big uptake in kids 5 to 17 when they're in school together. And also the under 4 comes following that, and plus over 65. So yes, it's a little better, but we still have another month or so to go.
Mm-hmm. Good to see that compared to 2023 numbers, that the hospitalization rates and deaths are down, as you noted. But
yeah,
keeping...
the reason for that is that, so many people have had COVID and so many people have been vaccinated, at least with something, that the overall immunity in the population is much better than it was before. So every year, that's going to have an impact. And remember, your immune system sort of forgets about COVID. So you're either going to keep getting COVID all the time, or you have to keep getting a vaccine. And the vaccine uptake is very bad. It's about half of what with the flu. And that's very unfortunate, because this is a deadly disease, especially if you're at high risk.
Mm-hmm. And speaking of vaccinations, there was a new study that came out recently discussing the quadrivalent flu vaccine for seniors versus the standard dose that you'd see in younger age groups. Can you talk us through that data?
Yeah, the quad high dose vaccine versus the standard dose vaccine was looked at in 12,477 people in Denmark. Has a very good medical system and very good records of everybody. And they compared the quad versus the standard dose, and it was a very dramatic difference. The quad dose had a 60% increased protection rate with decreased hospitalizations. So if you're over 65, take that 4 times the normal dose, and it'll really be much better for you.
Mm-hmm. And going on to our headlines, this week there was an announcement from WHO chief, the Director General, I should be more specific, warning health officials about a possible missed deadline in terms of global pandemic control. Can you break down that announcement for us and a little bit what the Director General was warning about?
Well, when we were in the middle of the pandemic, the WHO and everybody got together and said, look, we have got to prepare ourselves better for the next pandemic, because we made a lot of mistakes at the beginning of the pandemic. We hadn't had a pandemic for over 100 years, since 1918. So it was really chaotic and caused a lot of problems. what travel should be restricted, what overall restrictions, mitigations should be put into place. The vaccine development went very quickly, and the increase in the number of tests went from basically 0 to, millions of tests available per day in a relatively short period of time. All that was great. But there is still no legally binding treaty to fight the next pandemic. So we're kind of back to square one. That if there is another pandemic, there's kind of no roadmap to follow. The last time the world got it together on any kind of health treaty was in 2003, when they agreed on the Tobacco Control Treaty. And since then, there's been really nothing about improving worldwide health. And for pandemics, I mean, look how many millions of people in the world died. 1.1 million in the United States alone. And there is still no global treaty. There's no agreed upon way how we're going to face the next pandemic. And there's going to be another pandemic. We don't know when, but there is definitely going to be one. Goes back to the Justinian age. Records were first kept. There's been pandemics, and it just does. We don't know. Is it going to be 100 years? Is it going to be 10 years? Is it going to be next year? We don't know.
It's a very big question, and something that researchers are always on the lookout for. And so a very big and important case for the world to get its heads together on.
And it's very important for us to get our heads together on this. And it's not so much for research. Well, I mean, we can research it all we want, but it's really for the public health. And the public health for a respiratory pandemic is global, because virus doesn't know any boundaries. You can have plane loads of people, they can be spreading it. What if the mortality rate, instead of being approximately 1%, what if it had been 3%? What if it had been 5%? What if it had been 10%? Would we have martial law or something like that? I mean, that's quite serious if that many people died. And it's certainly possible. So we just have to be ready, and we're not.
And speaking of another health warning, not from the WHO, but from the CDC earlier this week regarding measles, something we've been talking about for the past few weeks here. But can you shed some light on what their announcement was?
So everyone's heard of measles. You get a rash, you can feel sick. But people forget that measles can actually kill people because it can cause encephalitis. Measles is one of the most highly contagious diseases in the world. So go back to the year 2000. Measles was declared eliminated in the United States. Eliminated. We had over 95% of the population vaccinated, and measles was gone. Well, guess what? It's back. There's been 23 cases relatively recently in the last 2 months. Little outbreaks have been reported in Pennsylvania, New Jersey, Georgia, Missouri, and the District of Columbia. Almost all those cases were unvaccinated. And it's just another thing that could be completely prevented with a standard vaccine course, which is highly, highly effective. And the measles vaccine has been out for decades. Avoiding that is you're setting yourself up to get measles and to get real sick and to spread it. And it's a potentially very debilitating or lethal disease.
And very contagious. And as you've noted in previous episodes, the efficacy of the vaccine, even after one dose, is up to 93%.
93%.
Staggering.
So, another preventable thing. Let's try to eliminate it like we did in the year 2000.
Another story that we have been talking about week after week are mosquito-borne diseases. This time specifically, we're talking about dengue, where on the southern hemisphere, summer is rolling through And especially in South America, there have been big booms of dengue. What can you tell us about this specific outbreak and just dengue in general?
Well, it's not just the Southern Hemisphere now. It's really the whole tropical area. So you've got the Caribbean. You get any place where there's measles, excuse me, measles, mosquitoes, and you can get dengue. So there were in 2023, there were 6 million cases reported. So that's the highest that's ever been reported. And of those 6 million, 6,000 died. All right. So it's not a high percentage, but there's an awful lot of people getting sick. The CDC estimates that those of the 6 million were reported, but there were probably 400 million cases. And to give you an example of how sick you can get from dengue, if you don't know anybody that's had it, I've had many patients come back from vacation in the Caribbean, some very expensive islands, dengue, but the nickname for dengue is break bone fever. You have such chills and rigid, muscle contractions and everything that you think you're actually breaking your bones. So you get really sick from dengue, and you can die from dengue. Right now, all we can do is just try to avoid mosquitoes when you go to those kind of places. The good news is there are vaccines in development, and there are actually drug treatments potential out there that are going to be studied.
Mm-hmm. And worth highlighting, there are vaccination campaigns going on around the continent of South America. Countries and governments are doing their best. They're using insecticides. There have been some shortages in some areas. But, if you are going to travel, like Dr. Murphy noted, bring your bug spray. You need to wear, loose clothing, make sure those mosquitoes don't get to you. But travel safe, and always also look at the CDC website before traveling internationally. You can find great resources for health warnings, anything you need to know before traveling. But closing out today's episode, there was an announcement recently made regarding the polio vaccine and who should get it. This is actually very recent. We talked about it a few weeks ago, and there was a different rule, so important to update. Dr. Murphy, can you explain the change?
Yeah, so the advisory committee to the CDC has recommended that adults who are unvaccinated or who just don't know their vaccine status should receive the inactivated poliovirus vaccine. So that's a change in the recommendation. This goes back to 2022. There was actually one paralytic case of polio. Now, most polio cases are very mild, or people don't even know they have it, but a few go on and you get paralyzed from the polio. Franklin Roosevelt had it. There are all sorts of people have had problems with polio. It can be very debilitating. So although there was only the one paralytic case in 2022, the overall number of cases in the United States had bumped up to 800. So again, vaccines, they're available and they're very effective.
Mm-hmm. And like the measles vaccine, have been on the market for a very long time. A lot of people have gotten these vaccines, and the risks are very great, as you just mentioned.
Mm-hmm.
On that note, I'd like to thank you, Dr. Murphy, for your time and expertise breaking down the data, the COVID numbers and statistics, as well as the public health infectious disease headlines for us again this week, all the way from Tanzania. Thank you.
Signing off from Dar es Salaam.
And have a great weekend, everyone. Thank you for joining us this week. As always, if you have any questions, please submit them down below or at any of our socials listed in the description. Have a great weekend.
Have a great week.